From our 22 News Broadcast Center, this is 22 News in Focus.
Welcome to 22 News in Focus. I'm Don Shipman. January is Birth Defects Prevention Month. This year's theme is Best for You, Best for Baby. Now, according to the Centers for Disease Control and Prevention, birth defects are the leading cause of infant mortality in the United States. 1 out of 33 babies in this country are born with a birth defect. That's more than 100,000 every year. So today on 22 News in Focus, we have 2 half hours dedicated to information about birth defects and preterm births in our region. In the first half hour, we're going to be discussing the types and causes of birth defects, as well as the current testing and diagnosis options as well. In the second half hour, we're going to be talking with a representative from the March of Dimes, an organization that's been dedicated to pre and postnatal care of babies and mothers for more than 7 decades. So we're going to start with this half hour, and joining me first here is Dr. Karina Schoen from the Division of Maternal Fetal Medicine at Bay State Medical Center. I want to thank you for coming on the program here. Let's keep it simple off the beginning here at the top. What is considered a birth defect first?
So a birth defect or a congenital anomaly is really any difference from the normal structures that we would see in a baby or a developing fetus.
And are they always severe or maybe life-threatening?
No, actually there's a really large variation in the kinds of anomalies that we see. Some can certainly be severe, but many can just be considered actually variations from normal. For example, we might see a blood vessel that's normally on the left side of the body but is now on the right. And if there's no other findings, this baby might not even need any additional care after birth.
So what are the different types of birth defects?
So really any organ that the baby has to develop has the potential to have a birth defect in it. So we can see abnormalities in the brain, the heart, the lungs, kidneys, or even in the skeleton, such as in the hands and feet.
And which are the most common that you see at the Children's Hospital?
So fortunately, the most common things that we see are also the ones that are most routine for our pediatric subspecialists to treat. We may see babies that have an enlarged ureter, which is the tube that leads from the kidney to the bladder to bring the urine down, or some babies who even are missing a kidney or have small kidneys. Other common things we might see are holes in the heart, particularly in the bottom part. We call this a ventricular septal defect, or VSD. And these babies also do fairly well, and some may even close during fetal life or early after birth and not require surgery. There are, of course, some other things that we see not normally, such as club feet or a cleft or an opening in the lip and palate. And these are things that we can all take care of here at the Children's Hospital. Being that we're a referral center, we also will tend to see some of the more rare conditions as well, and these can vary. They can lead from benign tumors in the lungs to openings in the abdominal wall, or even openings in the spinal column, such as spina bifida or an open neural tube defect. And these last couple are certainly more significant and need surgical treatment afterwards, but we are well prepared to take care of them for you and your baby.
And can a preterm birth lead to a birth defect, or a birth defect lead to a preterm birth?
So birth defects are happening in the first trimester. So the baby in the first trimester is really going through organ development at that time. The organs are developing and their structures are becoming fully formed. In the second trimester and the third trimester, that's when the fetus is really going through the maturation process and preparing for life after birth. And so when a baby is born prematurely, the organs are all fully developed at this point, so a birth defect is not going to happen. What can happen are complications of prematurity, and one of the most significant ones we find when babies are born preterm is difficulty breathing. And so babies might need to go to the intensive care unit and receive extra oxygen, or even be on a ventilator to help them breathe. This isn't necessarily because of a problem in the lungs or birth defect in the lungs, but just because that the baby didn't go through the full process of 9 months to let the lungs develop completely.
And then are these conditions always evident at birth, or can they manifest later on as the child develops?
Well, we're becoming much better at picking up a lot of these defects early on. We have detailed ultrasound that can do a lot of prenatal diagnosis, but you're right, we can't see all of these things before birth. Some of these are because the defects themselves may be very mild. A good example of this is a very small hole in the heart, or small VSD. This may be something that a pediatrician will hear a murmur right after the baby is born, and then have a follow-up echocardiogram that shows this small hole that wasn't really seen to us at 20 weeks. Other conditions are things that may not develop until the baby is much older, or in the third trimester into first year of life. And a good example of this would be something called coarctation of the aorta. That's when there is a narrowing in the big blood vessel that leaves the heart. This is a common finding that we'll see in the first year of life, but although can see in some babies at 20 weeks, it's fairly uncommon for us to be able to detect it.
And what about the infant mortality rate in our region for babies born with birth defects? Do we know what that is?
Yeah, so Massachusetts in general, our infant mortality rate is about 3 to 4 for every 1,000 live births. Of those infant deaths, about 15 to 20% of those are due to congenital anomalies or a chromosomal abnormality or an abnormal number of chromosomes.
All right, we're going to continue our conversation here. Once we return, we're going to learn about some of the causes of birth defects. You're watching 22 News in Focus. We're back here now, 22 News in Focus. Today we are talking about birth defects and premature births in our region with Dr. Karina Schoen from Bay State Medical Center. We've been talking a lot about all the different types of birth defects, but I want to talk about some of the causes. I guess first, overall, what causes a birth defect?
So in most cases, we don't know. The majority of them are actually unknown. As our advances in understanding in genetics happen, we are able to put more of these unknown causes into a genetic cause. But right now, unfortunately, a lot of times I'm telling patients that I can't put my finger on a cause. Otherwise, about 30% are due to some known genetic causes, either abnormal chromosome numbers or abnormalities and mutations in genes. And about 1% in the state of Massachusetts are due to other known causes, such as diabetes, or exposure to substances that are known to cause birth defects. And these may be certain medications like warfarin or Accutane, or exposure to substances like alcohol.
And then how often or how much of a role does genetics actually play in determining if a baby may have an increased risk for a condition that may lead to a birth defect?
It can be incredibly important. Whenever we find a birth defect or anomaly on our ultrasound, we always offer genetic testing for the pregnant person or couple because genetics may be playing a big role. And especially if parents come to us with a known genetic condition, we do strongly recommend that they meet with a genetic counselor or geneticist beforehand, so we can really talk about the risks of passing along that disease to their children and what the disease might look like during prenatal life and after birth. But even healthy couples have an increased chance of having a genetic condition. And the most common thing that we do screen for example, is Down syndrome. You know, this is a perfect example of something that doesn't really run in families, but does have the ability to affect each pregnancy, depending on your age and your other risk factors. And so we do recommend screening for this as well, because it can be associated with birth defects in addition to the diagnosis.
And does it matter where you live? I mean, are there some genetic conditions that you see here locally?
We do. I mean, the most common ones we see are things like Down syndrome or an extra 18th chromosome. but we see people all over the region. And so we do have parents come to us who are both carriers for, say, cystic fibrosis, which is a severe lung disorder. And then we end up seeing their babies who do carry the full mutation and have cystic fibrosis disease at birth. Other common conditions we'll see are babies who are diagnosed with a heart condition may have a common condition called DeGeorge syndrome, which can be associated with some classic cardiac anomalies as well. And so those are a few of the common ones we see, but we do see a multitude of different genetic conditions here just by the nature of being a referral center.
And you mentioned chromosomes. Some conditions are the result of either, you mentioned, an extra or a missing chromosome. So what are those conditions and how often do they occur?
Yeah, so I'll start off by saying we should have 46 chromosomes, one set from the mother and one set from the father. And when the egg and the sperm meet, there is always a chance that an abnormal number of chromosomes will be transferred into the embryo. Particularly as the eggs age, some of the chromosomes can get a little bit sticky and they don't separate as well. And when that happens, you might get a third copy of one of these chromosomes in the embryo. And one of the best known diseases is Down syndrome, which is really 3 copies of the 21st chromosome, so otherwise known as trisomy 21. The other common conditions that we'll screen for is trisomy 13 and 18, and these are the abnormal number of chromosomes or trisomies that will typically survive outside of the first trimester. And these will typically increase in frequency as the mom ages. So again, as the egg ages and it doesn't work as well to separate those chromosomes, we're going to see an increase in these risks. Fortunately for moms under the age of 30, the risk is less than 1%, which is very reassuring. Once you get to 35, that risk increases to about 1 in 80 pregnancies, and then starts to increase pretty quickly at the age of 40, where up to 1 in 40 pregnancies may be affected by a chromosomal disorder.
What if you freeze your eggs early on?
So you certainly can consider egg freezing. It is a much newer technology, but it also comes with some limitations as well as variations in success rates, but can also prevent some of the abnormal number of chromosomes because the egg age is younger.
Okay. A few years ago, many of us first learned about the Zika virus, and that's when a pregnant woman who became infected with this virus was in danger of a child with microcephaly, where a baby's brain or skull are smaller than normal. What are some of the types of infections that can affect the health of a pregnant woman and the unborn baby?
So particularly in Western Massachusetts and Massachusetts as a whole, we're having a big issue with congenital syphilis right now. Rates were going down, but recently in the last few years, these rates started to increase again, and we're starting to see ultrasound findings in babies that are affected. So this is an example of something that we do screen for routinely in pregnancy and several times so that we can treat early on and have treatment for the baby. Other infections that we look for specifically, if we see ultrasound findings, is something called cytomegalovirus or CMV. And this is one of the leading causes of congenital deafness in the United States. But unfortunately, we don't have any treatment that we can give to pregnant women to help treat their babies that might have that infection. But really, any infection can be dangerous for both mother and baby. There are some immune changes that happened during pregnancy that are very normal, but can place a mom at increased risk to develop a severe infection. A great example of this is influenza or COVID-19, where moms who get sick are much more likely to go to the intensive care unit. And a critically ill mom means a critically ill baby. And many of these might lead to preterm birth in order to improve the health of the mom. So whatever we can do to prevent infections during pregnancy is going to help improve the health of both mother and baby.
All right, what can be done to prevent birth defects? We're going to find out some strategies once we return. You're watching 22 News in Focus. You're watching 22 News in Focus. Today we are talking about birth defects and premature births in our region. Dr. Karina Schoen from Bay State Medical Center is here talking about this and giving us some really great information here. Modern medicine, medical science, for example, has made it possible to detect birth defects before birth and immediately after birth. So what are the reasons that pregnant women would need to have their unborn child tested for a birth defect?
We recommend that all pregnancies are screened for birth defects. Although there are certainly some pregnancies that are higher risk for birth defects, even a young, healthy woman can have a child that's affected. And prenatal diagnosis can be really important to fully informing the parents about treatment options that are available to them, but also making sure that the baby's born in the right location. So a lot of our outlying community hospitals won't have 24-hour access to our pediatric subspecialists. So depending on the severity of the anomaly, we may recommend delivery at tertiary care center like Bay State Medical Center, where we have all of these physicians on call and available to these babies if needed.
And is there a way to determine if someone is predisposed to having a child with a birth defect?
This is all about medical history. So the most common conditions that we see in our ultrasound unit are for women who are over the age of 35, women with a higher body mass index, so anything over 30, moms who are having twins or triplets, and with chronic medical conditions like high blood pressure and diabetes or exposures to medications as well. Something else that people don't think of commonly is also IVF, which can lead to an increased risk of birth defects as well, and we screen these a little bit more carefully.
And how are birth defects detected while in utero? Like what types of testing are available and what are their specific functions?
So there's a couple different time points where we'll see these pregnancies. Some are diagnosed as early as in the first trimester with an ultrasound. Ultrasound is using sound waves to look at the different organs of the baby, which is considered safe in pregnancy. But most pregnancies will get screened around 20 weeks, again with an ultrasound. And we'll examine the baby from head to toe, looking at all the different structures we had mentioned earlier. For babies that are particularly high risk, specifically for congenital heart defects, these patients may go on to get another ultrasound around 22 to 24 weeks, and that test is called a fetal echocardiogram. Again, it's all done with ultrasound, but it's a specialized test looking really at the function of the heart and how the valves are working for patients who are higher risk of having babies with this kind of disorder.
What about prevention strategies? What types of prevention strategies do you have?
The best prevention is really just going in as healthy as possible to your pregnancy. So we recommend seeing a doctor before you get pregnant or considering getting pregnant to make sure that if you do have any medical problems, that any medication you're using is compatible with pregnancy and not known to cause any birth defects. But also making sure that your medical conditions are under control, particularly diabetes. For example, the high sugar levels or glucose levels in diabetes can be particularly toxic for an early embryo. And so when we have moms who have diabetes get back down to normal glucose levels, this can do a lot to actually reduce the risk of having a congenital heart defect or a defect in the neurologic system.
And I think you kind of answered this, but what should a woman be talking to their doctor about before actual, conception, before when they talk to their doctor first?
Yeah, well, the most important thing is really just coming for that visit. A lot of women don't, and we have a lot we can offer to them beforehand. But the other things you want to talk about are really any over-the-counter medications that they're taking or herbal supplements, because some of these also might be not the best to take during pregnancy. Other things you might want to consider talking about are things like issues with smoking. Smoking is a very difficult habit to try and stop, especially preconception. And so if you need help with your physician prescribing things like patches or gums, it's a good time to talk to them. And also with opiate use disorder, this is something that we're seeing a lot in pregnancy. So if you're trying to get pregnant soon, it might be the time to ask your doctor because we do have medications that can be safely used in pregnancy, and we always want a woman who's stable on their medication regimen before going into pregnancy for better outcomes.
And prenatal care is essential. So what does that consist of?
So the early part is a lot of education, a lot of blood tests, and talking about what those blood tests are, and then talking about the different genetic screening options that are available to you, as well as what kind of ultrasounds would be needed for your specific pregnancy. And you're seen about every month. As you get later on in the pregnancy, you may be seen every other week or weekly, depending on any other medical disorders. And at this point in the pregnancies, we're really screening for any issues with growth that the baby might be having, and a reason to get another ultrasound to make sure the growth is normal, but also checking your blood pressure, because there is a disease called preeclampsia, which typically happens in the third trimester and is associated with high blood pressure in pregnancy. And for someone, this can be particularly severe or even life-threatening. So early diagnosis is really the key to managing this disease.
And then if you do detect a birth defect early on, is there something you can do?
Yeah, so some of these birth defects can be treated in utero. It comes with a lot of counseling, but a good example is spina bifida, or an open neural tube defect. There is data to show that for a select population of cases that do have this, that repairing that birth defect while the baby is still inside the uterus will lead to better health outcomes for that baby later. So those patients are always referred to us, and we do a lot of counseling, and then also do some referral to our specialized fetal centers for that.
All right, we're going to have the final word just after the break. You are watching 22 News in Focus. You're watching 22 News in Focus. Today, we've been talking about birth defects and preterm births in our region with Dr. Karina Schoen from the Division of Maternal Fetal Medicine at Bay State Medical Center. I want to thank you for coming on the program and sharing your expertise.
Thank you so much for having me.
And coming up in our following half hour, we're going to continue this topic with a representative from the March of Dimes. And that is our program for today. If you did miss any of this, you can, of course, watch it in its entirety at our website at wwlp.com. Have a good day.
From our 22 News Broadcast Center, this is 22 News in Focus.
Welcome to 22 News in Focus. I'm Don Shipman. Founded in 1938 to help combat polio, the March of Dimes has expanded its efforts to include the prevention of birth defects and infant mortality. The organization has helped millions of pregnant women and their babies with pre- and postnatal education and medical support too. Every year, the March of Dimes issues a report card that provides information on the health of mothers and babies across the country. This report highlights the instances of preterm births and infant death rates, access to prenatal care, and other factors that can directly impact the health and well-being of mothers and babies. So joining me now is Stephen Sykes, the manager of donor development for the March of Dimes, Massachusetts. Thanks for coming on the program. Really appreciate it. Let's get started here, because talk about the March of Dimes first, and the work that's done here in Massachusetts.
Yeah, so the March of Dimes, as you mentioned, was actually started in 1938 to beat polio, and we did. But our mission is truly to help moms and babies. We work every day to prevent preterm birth, birth defects, and infant and maternal mortality. We want to know what causes babies to be born too soon, and then solve it so that doesn't happen to anybody else. So our whole world, our whole mission is around healthy moms and strong babies. We do this by a number of ways. We have big advocacy that we do. We're at the State House quite a bit. We're in Washington quite a bit, making sure policies that impact moms and babies are really brought to the forefront. We have big research, and you mentioned our education. Our website, marchofdimes.org, is just chock full of very good information. So the work that we do is impactful, and it's all about supporting moms and babies.
So what types of programs do you offer here locally?
So the biggest thing that we do, our keystone program in this state is called NICU Family Support. So as I mentioned earlier, that our focus is preventing premature birth defects, and infant mortality. Well, in the event that baby is born too soon, they end up spending time in what's called the neonatal intensive care unit, or NICU. Well, you can imagine how scary that is for a family to, first of all, have a first baby, is big enough as it is, but then to go into an ICU, to a NICU. So March of Dimes has staff and partners at hospitals across the state and at Bay State here in Western Mass that help moms and dads and families go through this. It's really emotional and educational support that they do. Ideally, I like to tell folks that when the doctor comes in and downloads all this wonderful information to mom and dad, you can imagine moms being, really, there's a lot going on. We take the notes, come back later with a cup of chamomile tea and said, this is what the doctor said, and kind of work it through it. We do as much as we can to normalize the experience and provide a lot of good education in support of the great work that the hospitals do. So that's the big keynote program that we do across the state. It really helps.
And do you provide information and training really to health professionals too?
Yeah, so part of that NICU Family Support Program is providing training to the nurse professionals, both on a CMU, so we give accredited training to the nurses and the staff in the NICU. Outside of the NICU, we provide a lot of implicit bias training. So, there's a lot going on in this country. We talk about how implicit bias impacts healthcare, in the state and across the country. So, independent of the NICU Family Support Program work that we do a lot of nurse training, specifically around implicit bias training that we do. So, quite a bit of training that we provided to medical professionals.
And we've been talking a lot about prenatal care and how essential it really is. What does it consist of when it comes to the March of Dimes?
Yeah, so we define prenatal care as the medical care that you get during pregnancy. And one of the things that we know as healthcare professionals and public health professionals is that quality and frequency of prenatal care does impact birth outcomes. So one of the things that we suggest is that if you think you're going to be pregnant or you think you might be pregnant, please visit with your healthcare professional. Set up a routine to go see them on a regular basis. This prenatal care does a lot of things. It checks in on you, it checks in on the development of the baby, and it helps in so many different ways, up to and including early intervention. There's some prenatal testing that goes on in that. So I can't strengthen enough, can't focus enough on the importance of getting really good prenatal care.
Lots of great little baby pictures here that we're showing. What about when a baby is born? Is there support for mothers and the newborns after?
Yes. Yeah, there is. So one of the biggest things that we look at, we understand that across the country there's an information gap. And you mentioned our website earlier. Our website, marchofdimes.org, is chock full of very good vetted information on that. So if mom's pregnant and even after the baby's born has a question on anything, go into marchofdimes.org, go into the education piece, put your question in, and answers come up on that. So that's the very first thing that we do. It's both in English and in Spanish. The Spanish one is called Nuestro Sano. Very good, again, vetted information. There's no politics on that. It's very good March of Dimes content that's on that. That's the first thing that we do for moms prenatal and after the baby is born in first year of life. And again, if something doesn't go right, we're the organization that has folks in the NICUs and provide the training and the support, mainly the NICU family support that we do through that. So quite a bit of information that we do with folks.
Okay, you guys do a lot of research. How is your organization funded?
So how's our funded? So we are funded in 1938. We're the original crowdsourcing organization, right? So citizens across the country sent dimes to the White House to beat the president's disease. And the president's disease was polio. So about 10 or 15 years later, the mid-1950s, we beat that. So that theme is consistent now. All of our funding, the majority of course, we have corporate partners, but the majority of our funding comes from ordinary citizens who sign up for March for Babies or send a donation in or do some annual giving with us. But the majority comes from ordinary citizens. Back to the DNA of sending in dimes to us. They recognize that our mission is so important that they want to help us do that. So we get $50 checks, $25 checks, and then people actually do fundraising through our walks. It's called March for Babies.
All right. All right. What can be found in the March of Dimes 2020 report card? We're going to find out once we return. You're watching 22 News in Focus. We're back here now, 22 News in Focus, and today we are talking about the March of Dimes annual report card with Stephen Sykes with the March of Dimes, Massachusetts. So let's start with that report card. What is in the report?
So every year for the past 10, 20 years or so, March of Dimes has gathered information from a variety of sources, and we come up with a national report card and a state report card. We look at things like preterm birth rate, infant mortality, preterm birth by race and ethnicity. That's very important that we look at. And we also look at selected social determinants of health, things like uninsured, inadequate care, and poverty. We bring all that together and we come up with a grade for the country and for each state. We're looking at the state of Massachusetts right now, and you can see that the preterm birth grade is B-. It's been consistently in that range for the past several years. The preterm birth rate is 9%. What that means is 9% of all babies born in the state of Massachusetts, and there's 72,000 babies born per year in the state, are born premature. And as we talked about earlier, premature birth and birth defects are the two biggest drivers of infant mortality. So it's a very important rate that we look at. So about 6,300 babies per year in the state of Massachusetts are born premature. So one thing that our report card does is it codifies that. It brings out the data so you have a benchmark year over year to see how we as a culture, we as a civilization are treating our babies and treating our pregnant moms. So it's actually a pretty important report that we come up with.
And we can also see how we compare to other regions, other states and stuff like that throughout the country. How do you gather and compile that information?
So there's a lot. There's a whole department here at the March of Dimes that spends literally year-round gathering this information. We bring it from state data, DPH data, Department of Public Health data, across each state, from federal data. We combine it all together, we normalize it, and then generate a report. And as I said, there's a whole department here that works year-round on gathering, vetting, and publishing this data. So it's pretty good. And if you look at the report card across the country here, you can see that we as Massachusetts are actually doing a lot better than some other states. The ones in red generally have a preterm birth rate in high 11s, low teens in that number. Poverty and access to care and prenatal care and access to prenatal care are some of the drivers of that. So we're doing okay in the state, but we've got a long way to go to get it where we want it to be.
Yeah, you're kind of touching on this because the report has found that the U.S. remains among the most dangerous developed nations for childbirth, and it's even more dire for women and babies of color, with the nation dropping from a C to a C-. So why is that happening?
Yeah, you know what? That's that's the core issue that we're looking at, right? So there's no single cause of this complex crisis. Not only is it impacted by medical factors, it can be traced back to systemic challenges with healthcare systems, social determinants of health, like access to care and poverty, and deeply entrenched structural racism that's fueling the health equity gap. March of Dimes understands that. The one thing that our report card does, I don't care where you are on the political spectrum, you can look at our data and you can say that, especially in the state of Mass, moms of color have a much higher rate of preterm birth and a significantly higher rate of infant mortality. That's the core issue that we're looking at. So March of Dimes is looking at that. We're working on that.
And what about the coronavirus? Has the pandemic played a role in these results?
So, the data is still out on that. The one thing that we don't do, we don't just take quick data and turn around. So we're still looking at it. We're still trying to figure out, where it is on that. But some of the early things that we're concerned about, though, some of the early testing didn't have pregnant and lactating women in some of the early trials. So we want to make sure that any vaccine that comes out is safe for moms. I'm not saying that it's not, but if you are pregnant or soon to be pregnant, we suggest that you talk to a healthcare provider before taking any vaccine that comes out.
And then on a more positive note, the report does show that infant mortality has decreased by a small percentage here. So what's being attributed, what are we attributing that to, that change?
I would agree, but it's a minimal improvement. The fact remains that over the past couple of years, it's been about 22,000 babies per year don't make it past baby's first year of life. So infant mortality. And again, if you look deeper at that, especially in the state of Massachusetts, the Black infant mortality rate in Springfield runs in the 12 rate per 1,000. And the rate comes from infant mortalities, deaths, per 1,000 live births. So Black moms in Springfield have an infant mortality rate hovering in the 12 number. Guys, that's 3 times the state infant mortality rate. So yes, across the country, the number has gone down just slightly, but really it's still 22,000 babies per year, or 2 babies per hour, go to heaven and don't make it through that first year of life.
What a dramatic disparity, though.
I
3
would say
times.
It's still in the same range.
That's a dramatic disparity, though, isn't it? That 3 times the rate, you're saying.
Yeah, it certainly is. And it goes back to what I talked about before. Systemic racism is certainly a part of that. Social determinants of health are certainly a part of that. March of Dimes, and if I'm not coming out with a direct answer, because March of Dimes is researching to find out exactly what's causing that. Once we come up with the answers, we can be able to advocate for policy changes that will impact some of these numbers. But we think, we're doing some research at the University of Chicago that looks at the impact of structural and systemic racism on stress for moms. What we're finding out is that the stress may be changing the DNA in the population, specifically in Chicago, and that may be one of the reasons why preterm birth rate is much higher in that. But again, it goes back to systemic racism, which is certainly out there.
All right, after the break, what's being done to improve the report card's grades? You're watching 22 News in Focus. You're watching 22 News in Focus. Today we are talking about the March of Dimes annual national report card on the health of pregnant women and babies with Stephen Sykes, the manager of donor development with the March of Dimes Massachusetts. So what can be done to improve the health risks and the factors that lead to preterm births and birth defects?
Yeah, thanks for the question. From a community perspective, there are lots of groups of organizations led here in Springfield by the Maternal and Child Health Commission that focuses on these issues. We all come together monthly, we share best practices, we come up with ideas, but we know one thing, that the health of the mom and the baby are intertwined. Addressing maternal health factors, especially prior to pregnancy, increase the chances of a healthy full-term birth. This includes identification and management of chronic conditions like obesity and diabetes. Taking a multivitamin with folic acid will reduce birth defects, and eating a healthy and increased physical activity may reduce the chance of some preterm birth. The inequitable conditions such as unequal access to housing, transportation, healthcare, and neighborhood safety also affect a person's ability to achieve good health, starting at birth. The report card shares data on social determinants of health, showing that women of color, again, are more likely to be uninsured. So from a public health perspective, there are organizations that come together. What we are looking to find out is that, as well as what triggers labor, right? So in public health, we're not really sure what triggers labor yet. So one of the things that our research is trying to figure out is what triggers that. Once we figure that piece out, we can figure out what's triggering preterm labor. So if we really think about it, preterm birth and these negative birth outcomes have 2 buckets, right? There's the biological reasons, which our big research is trying to help us figure out. And then there's the social determinants of health issue, which we're addressing, and many organizations are addressing in town and across the state and across the country. Again, access to care, getting good prenatal care, healthy diet, reducing stress. Those are the type of things that we know will have a positive impact on birth outcomes.
Sounds
But
like
I will
it's a
say,
big.
if someone has had a preterm birth and a negative birth outcome, it wasn't your fault, right? There's a lot of things going on with this. The body is a wonderful thing. It wasn't your fault. We're the organization that's trying to figure out what caused that in the first place.
That's a good point to make, and it sounds like it really is a collaborative effort there. How can people get involved with the March of Dimes?
So a number of different ways. The key way that people really get involved with us, they want to make sure this doesn't happen to somebody else. So they join our walk. I talked earlier about the crowdfunding that we've done. Well, we've had a March for Babies going on 40, 50 years from now. We actually started the big walks. So this year, I'm proud to say that our March for Babies, again, will be virtual. Hey, there's a pandemic going on out there, but this time we're doing it, we know going into it that it's going to be virtual. So a lot of really cool interactions that we're going to have, lawn signs, virtual sprints, coming together on a Fitbit app and using tracker apps like that for your teams. So the key way I would say to do that is join March for Babies Massachusetts. Just go to marchforbabies.org, put in Springfield. The Massachusetts walk will pop up. Join that, and then I will frankly probably send you an email and contact with you. But the work that people do with that, the fundraising and the walking and the activity around that really helps. It helps the catharsis of the family that perhaps had a negative birth outcome and wants to turn that into something positive. And of course, in the funding, the money that you raise helps us do our research and advocacy and all those type of deals. So that's probably the first way to do.
And I was going to say, it also promotes a healthy lifestyle. You guys also have a lot of programs that that help to kind of expand on a healthy lifestyle that people should lead.
Absolutely. So, again, from our website, you want to make sure there's a healthy diet, but activity is a key thing. We especially, we all have the fitness apps now, so we want folks out walking around. Social distance, of course, wear your mask, but being active, eating a healthy diet, and maintaining good health is important. Absolutely.
And then you mentioned health insurance and lack thereof for women of color, for example. So do you guys have any kind of program that's available to women who don't have health insurance, or even a doctor?
So one of the programs that we have is called as a group prenatal model, and we had it in Springfield until Corona hit, to be honest with you. It's called supported pregnancy care. One of the good things about Corona is we're taking that group prenatal model and making it virtual, right? So the plan is, hopefully very soon we can have prenatal care virtually, by providers. We provide the curriculum across the country. So the access to care and the access to health insurance is called a maternal care desert. So we are advocating and coming up with policies across the country to make sure that moms have access to care. And believe me, whenever health insurance comes up in the Capitol, we are there advocating for moms, for babies, to make sure that pregnancy is covered, to make sure that pre-existing conditions like that are covered. But the maternity care deserts, which is lack of access to care, across country, there are moms who have to travel an hour and a half to get a prenatal visit. There's something wrong with that. We can put a person on the moon, but we still have to have moms travel an hour and a half to get prenatal care. So our reports, our advocacy, and our research is helping change that.
What about infant mortality rate? What's being done to improve that with your organization?
So again, the two biggest drivers of infant mortality, as we know, are premature birth and birth defects. So again, research on that, advocacy around getting access to care, and everything around that. So if we can reduce the premature number, we can actually reduce the number of infant mortality. And in this state, there are about 400 babies per year that go to heaven in the first year of life. And that is the worst possible outcome. The way we measure that is, again, by trying to reduce premature birth through the methods that we talked about earlier.
All right, we'll have the final words once we return. You're watching 22 News in Focus. You've been watching 22 News in Focus. Today, we've been talking about the results of the March of Dimes National Report Card on the health and well-being of pregnant women and babies in our region and the country with Stephen Sykes, the manager of donor development for March of Dimes, Massachusetts. Thanks for coming on the program.
Thank you. Yep.
Really appreciate it. And if you missed any of this program, you can, of course, watch it in its entirety at our website right now at wwlp.com. From all of us here at 22 News, have a good day.